I often get the question from new patients, why do some people need to wear the braces more than one time? Oftentimes parents have a friend or kids have a friend in elementary school that has braces, and the mom will come in concerned saying, why does Johnny's friend have braces? He's only in second or third grade. He doesn't even have all his permanent teeth in. Why would he have braces now? And does he need them again afterwards? So it's a very valid question, and one that comes up. I'm not a huge fan of doing braces 2 times when it's not necessary. But there are definitely a handful of cases where it is a good idea to do braces. Sometimes 2 times. We call that a phase 1 and a phase 2 treatment. So a phase 1 treatment is an interceptive treatment. It's a treatment that is done before the full set of teeth are in, and it's usually done to intercept a big problem that's going on that will probably or have a good chance of causing problems down the road. So there are a couple reasons why we would do this. Number one is a growth imbalance. So if you have an underbite, so if your lower jaw sticks out over your upper jaw. Now this is typically how you would like your teeth to fit together like this. Oftentimes people with an underbite, their lower jaw will protrude or stick out relative to their upper jaw. There's a couple reasons that this happens. Two of the main reasons are, just that either the upper jaw is not developed as much or the lower jaw is growing too much. And most of the time this is because of a genetic component. You're going to have a father or an uncle or a grandparent who has the same issue. So this would be a reason where you would want to start braces early. Reason being is to correct this, you're not just correcting a tooth problem, you're correcting a growth imbalance or a skeletal problem. You actually want to restrict the growth of the lower jaw and help the upper jaw grow a little bit more. This is done much more efficiently and effectively on younger children than it is when you're older. Really, the ceiling to do this is about 9, 10 years old. Sometimes you can get away with doing it at 11, 12 years old, but the rule of thumb is the earlier the better, and that's just because the younger you are, the more the bone turns over, the easier it is to get actual skeletal improvement there. And so you're gonna see some kids with underbites that have braces on and that have to wear headgear at night, and what that does is just slowly pull the upper jaw forward to where that face and those jaws are in harmony and in balance. So big reason is that underdevelopment of the upper jaw or overdevelopment of the lower jaw. The second reason that I want to discuss is a habit. Oftentimes kids will come in with and the most common is a thumb habit. So you've got your upper teeth here, and Mary, when she goes to bed, she puts her thumb right in there for that soothing effect, and she creates a little bit of suction there. And what that does is actually having that thumb in there night after night causes that upper jaw to narrow and constrict. So we want to try to break that as soon as possible. So at the very least, if there's no skeletal change, no tooth change, we have appliances that fit right in the upper mouth and kind of just distract the thumb there and give the child a little bit of motivation to not put their thumb there. If we have some tooth movement or some jaw deformation, then we have appliances that we'll discuss later that do fix that as well. So if you have a habit, that would be a reason to get braces early as well. Another reason you would want to get braces early is if the teeth were in a traumatic position. Sometimes you don't have a jaw imbalance, but for whatever reason, the teeth came in just a little funny, and you'll have one tooth hitting underneath. Say you'll have a top tooth hitting underneath the bottom teeth. Oftentimes it's not because the jaws are out of harmony, but the tooth is just displaced backwards. There just wasn't enough room, and it didn't come in the right way. The reason you want to get that corrected earlier rather than later is every time you chew, every time you bite, you're creating trauma, micro trauma to that area. You want to get those teeth in the proper position to relieve that chance of actually having something traumatic happen to those teeth. Another reason someone may need interceptive treatment or phase 1 treatment is from severe crowding. If you have so much crowding, it's limiting the chances of your permanent teeth to come in. Oftentimes we will intervene, and we can do that in a number of ways. One way is by just making more room. We can either spread the teeth out a little bit more or tip them in certain ways to make room, or we may direct the general dentist to remove some of the baby teeth at the appropriate time, and that will allow the permanent teeth to come in nicely. Otherwise, if nothing is done, oftentimes you will have teeth getting impacted in the bone, which leads to more complicated surgical procedures down the road, things that we want to avoid. The fifth reason that you may need phase 1 or interceptive treatment would be speech problems. We often get referrals from speech therapists. Now, if you think about it, you use your teeth a lot to talk. When you're making certain sounds, certain consonants and vowel sounds, like a TH, for instance, you're going to put your tongue right in between your top and your bottom teeth. The T sound, the sound, you're going to put your tongue right behind your top teeth. So there a lot of the noises or sounds that we make in the American language and in all languages in the world are very dependent on the position of the teeth. So oftentimes people with speech impediments or other type of speech issues have issues because of the position of the teeth. So those are things we often can fix early and can help children with if those issues arise. The sixth issue that we address early are airway issues, and these patients will often come from pediatricians. So if your child is snoring, just having a hard time breathing at night, has been diagnosed with sleep apnea at a young age, those are reasons that we would want to see the child and actually expand the palate. Just by widening the teeth in the upper jaw, we can get amazing changes in the volume of air that is produced and being able to be inhaled and exhaled in young children, and it often does wonders. The last reason that you may want braces early is purely social reasons. Oftentimes I'll have young kids come in and say that because their teeth are, flared or that they have buck teeth, kids make fun of them at school and they're just having a little bit of a hard time. So in those cases, I let them know, from a functional standpoint, from a medical standpoint, you don't need braces right now, but I certainly can do them for you just because of that reason, to get those permanent teeth nice and straight, knowing that we'll monitor you and you may need braces again when the rest of those permanent teeth come in. When you have the braces early, there's always that chance that the rest of the permanent teeth are not going to come in ideally. So what we'll do is we'll put the braces on early in cases where you need it, and then once the braces come off, we'll monitor the rest of the teeth coming in. Sometimes they come in very nicely and you don't need braces, or you just need a few tweaks. Other times, they come in like the previous teeth came in and you almost need another set of braces. Nice thing is, usually when you get the interceptive treatment done, you're reducing a lot of the complications that would have come about. So instead of having a long, complicated 2.5 to 3 year treatment, you're having a 6-month phase 1 or interceptive treatment, and then a 1 year, 12 to 14 months phase 2 treatment. So you're really breaking that up and making it a lot easier.